Welcome to Utah Stories. So today we got a great program. We're talking about how to make a resource center ideal for both neighbors and homeless individuals, how to create affordable housing in neighborhoods. I've got on the program with me Jillian Olmsted, who is the CEO of the In Between, and they've produced this exceptional model for how to do it right. Thanks for coming on the program, Jillian.
Thanks for having me.
Yeah, I gotta say, right when you walk in your facility, it is just such a stark contrast to walking in any homeless resource center. I'll pull this in front of you a little closer. That I've ever walked in before. Obviously, that was done by design. How and why was it produced to be such a nice, warm, inviting place?
The original mission of the In-Between was to be a home for individuals who didn't have a home so that they could receive either hospice services or medical respite. So the goal was to just replicate exactly what you'd be experiencing in your own home. So we have living areas, we have a dining room, we have individual rooms that are all decorated differently. So it doesn't have that hospital feel to it, much more like apartments.
Yeah. And I think that, like, it's a place where you feel comfortable and feel like spending time. And the reaction, unfortunately, that I get from all the homeless people I've interviewed to the homeless resource centers and the shelters is it feels like a prison. It feels like a jail. It feels like they're kind of really suspicious that these people are bringing something bad inside. But it seems like you guys just trust the homeless individuals and you just give them sort of free reign. Is that what you're doing?
Yeah, I think the way that we treat them is really what we get back from them. So we give them a lot of respect. Everybody has keys to lock their doors. They have safes in their room, but a lot of people leave their doors open. People can come in and out freely. We do ask that residents don't go into other residents' rooms, that they meet in common areas, but we really don't have problems with theft in the building or violence. We have very few calls to 911. Typically, there's only calls for some sort of mental health crisis that maybe we can't solve with the staff that we have. But yeah, we treat them just like we would treat our parents if they were end of life.
Yeah, and you just get a really positive vibe. Everybody there's happy. I saw when I was meeting with you guys some of the patients, and these people are like half of them are dying, right?
Yeah, it's actually about 15% of our residents 15%. are end of life, and hospice care is our priority. Ironically, despite how much our services have increased, really the number of individuals dying in our facility has stayed about the same. So this last year we served 136 people, and 15 of those individuals passed away. So we're not sure why our medical respite needs keep going up so much and the end-of-life care is not, but to me that seems like a good thing. Hopefully that means that more people are getting help before they get to that end-of-life point.
So a lot of them come in to die, basically, which is really sad, but then they end up recovering?
Yes, we do have a lot of people who come in on hospice and end up getting better. There's also a lot of individuals who come in that qualify for hospice but don't want to go on hospice just because to them they feel they're giving up and they can't receive any additional treatment. So some people come in on palliative care or just general medical respite. And it's really that their disease is just so exacerbated by living out on the streets and not getting sleep, not having meals, not having appropriate access to medical care. So something as simple as diabetes can, lead to an amputation, lead to an infection, which could lead to end of life. Yeah. But if we can get in there before it gets to that point, that's really our goal of the medical respite side of our program.
Yeah. I want to show on the screen for those of you joining us on YouTube an LA Times article which featured you guys. And this was a great article.
It really, yeah, it was awesome having them.
I was blown away. This article kind of shows some really great photography of just how much love, respect, support the tenants are getting there. I want to read a little bit from this, and it says, when Rob was dying of stomach cancer in January, the butterfly, which I guess you use to just show that he's about to likely going to pass away,
Yes.
was affixed to the door of his room. Resembling monarchs in blue speckled with splashes of white, the butterflies signify someone is transitioning and reflect the facility's policy that no one dies alone. The official mission of the In-Between, located on a quiet street in Salt Lake City, is to end the tragic history of vulnerable people dying on the streets, but there's a debate about the true meaning of its name. Is it the in between the streets and the hospital, or in between heaven and earth? So what's your answer to that?
It depends on who you ask, but I believe that the original visionary, who was a nurse, it was in between the hospital and the street, because she really talked about working up at Huntsman and having people come in for cancer treatment, maybe getting close to end of life, but the hospital wouldn't keep them because they weren't sick enough to be hospitalized, but they really weren't well enough to be discharged to the street. So that was really what created the mission of the In-Between.
Yeah, and that's a great mission. And so, I mean, as I go out on the streets and interview homeless people, it seems like a lot of them should be in an in-between. You guys have 50 beds. Your model has proven so successful. Why do you think the city leaders or, other NGOs aren't emulating your model more?
I have no idea. That's a great question. I have no idea, because the cost of a night at the In-Between is, this past year was less than $100, but we were really working on a tighter budget. It should probably be between $115 and $150, depending on if they're end of life or like short-term respite stays, and with a much higher outcome. So you think about using the emergency room as your primary care doctor. Very high cost and very low outcome, because you might go in there and there's just a Band-Aid put on your disease or your situation. You're going to go back out to the street, and you're probably going to come back a couple weeks later because you didn't get better or your medications were taken.
Yeah, and that's such a common problem where you find people going into the homeless resource centers, and they'll say no medication allowed, and I'm like, I find that hard to believe. I've tried to ask that question to a lot of the administrators there, and they say, no, we allow medication. We just find people take pill bottles and put illegal drugs inside of them.
Oh, I see.
And so they're very wary of that. Do you have any kind of problems with drug use at your facilities? Do you run into that once in a while?
There's some. When someone comes into the In-Between, we do drug test them, not to prevent them from coming into our program, but to see where they're at. Do they need to go to detox? Do they need to go to a rehab before they can come to the In-Between? And we go through all of their medications, make sure they have prescriptions for all of them, make sure the pills in the bottle match the prescription. And usually everybody's pretty understanding. I think a lot of times that's not because someone wants to abuse drugs. It's because that's how they're controlling their pain, because they can't get prescribed proper medication anymore.
Yeah.
So we're very cognizant of that and know that we need to figure out how to provide the proper supports to them, because taking away their street medicine with no other option is not the best thing either.
Yeah. And it sounds like the nurses there and the staff are really respectful of people wanting to look good and just providing basic dignity. In this same article, it describes a woman named Patty Larson, who she's got stage 4 lung cancer when she entered the facility. And in her photo, she was looking very bad, very thin. Her face was drooping. Her hair was slicked back tight, blank expression, mouth agape. Says today her face is fuller and often smiling. Her nails are painted hot pink. She lets her thick gray hair down. And so she was given 6 weeks to live a year and a half ago at your facility.
Yep.
So she lived a lot longer. How long did Patty live?
So she's probably going to be one of our best miracles that we've had in a long time. So when we brought Patty into the facility, there were a lot of people in the community that said, good luck with her. She's difficult. She'll cause you lots of problems. She actually got discharged for breaking house rules, came back, was ready to, receive the help that we could give her. She just found out last week that she is in remission.
Wow.
And she also just qualified for the New Choices waiver, which I think we talked a little bit about that. We're not able to bill Medicaid yet, unless someone is on New Choices waiver. And that person would have to be with us for a full year before they can apply. And that's really rare, right? Our mission is short-term medical respite stays or end of life. So our average stay is way less than a year. But we applied. It got rejected a couple of times. She finally got it, which means she will now be funded for the rest of her life. She can either go to an assisted living facility. She can go to an apartment. She could go back to a home if she had it. She does not. But yeah, she's actually looking at some places where other people from the in-between are living because she would like to go where there's people that she knows. So she's very healthy, and then now she's going to be housed. So
yeah, it's just amazing.
We're really excited for that.
And I think one key component that you have in common with the other success stories, Switchpoint, the Other Side Academy, is you insist people have a job, that they take ownership in the facility, and if they don't have a job off-site, that they actually work in the facility. What do those jobs look like?
They really vary. So we have people that are helping our facilities manager, so that could be leaf blowing or mowing the lawn. Again, we're housing individuals who are dealing with the medical crisis. We have a lot of amputees. We have a lot of people that don't feel well, so we want to meet them where they are. So can it be as simple as wiping down the handrails, which was a very common activity during COVID, or wiping down dining room tables, or maybe wheeling someone out to the patio because they want to go and smoke, but they can't wheel themselves out. Mm-hmm. So a variety of different things. And then we also like to hire our residents if we can. So we have 3 house managers that have been with us for a while. One of them is a CNA, so she can help if we need any assistance with nursing. And then we have one person who is our driver. He does all the transportation to and from medical appointments. And then another resident turned house manager is an end-of-life doula. She became interested in that, and we paid for her training, and now she's helping everyone that comes in with their end-of-life wishes. And then recently, we went to hire one additional house manager, and 5 people applied. We had a really hard time deciding who to hire, so we decided to hire all 5 of them part-time for just 90 days and help them get either case management certifications or become certified peer support specialists or anything else they're interested in. One has their food handler's permit and is helping out in the kitchen. So our goal is to just kind of give them a boost for when they leave the facility. They'll have lots of job training experience. And then we're also doing these peer meetings where they can give us feedback about what it was like at the in-between. What worked well, what didn't, was intake difficult, or was it too lengthy?
Wow.
Things like that. So we can get that lived experience feedback that we've been trying to figure out how to get, and it was right in front of us. They've been really helpful giving us information.
Oh, that's great. And so if we back up and just examine how the in-between started and how you got to where you are today, what is that origin story? What did that look like?
Yeah, so originally it was a nurse, like I mentioned, up at Huntsman Cancer Institute that said we just have to come up with a solution for where individuals are going to go between the hospital and the street. She actually worked closely with 4th Street and lots of other individuals in the community. It took many years. I think about 7 years before they finally incorporated and then worked to find a place to open the original facility. And that was actually the Catholic Church that helped with that. They let us utilize the old Guadalupe Elementary School and a convent. It turned out that the school needed an earthquake retrofit, which was going to be way too expensive. So we tried to squish as many people as we could in the convent. We could only fit 16 beds. A lot of people were doubled up. One room had 4 beds. It also had a staircase in it. So we had to figure out, who's bedridden, who's not, who can ambulate the stairs, who can't. So we started looking for another facility. And we ended up finding the facility we were in was about to go up for sale. And we were able to purchase it before it went on the market for a really great price, much less than what it would have cost to build a new facility. And also we were repurposing a facility that, may have just been torn down with condos put up, who knows. But we talked a little bit about this when we met and the consternation with the neighborhood. We went through it.
So this is the facility you're at now?
Yeah, we went through it at both facilities. So when we were just west of downtown, we definitely had a lot of pushback, especially because we weren't established. We couldn't say what it was going to be like. We couldn't make any promises. So I think it was scary for a lot of the neighbors. But they warmed up, and we started having a neighborhood advisory council meeting once a month, and we just allowed the community to come in and ask questions and what are they seeing and what can we do better. Moving into the new facility, it really was just a few individuals that launched this campaign against us moving into their neighborhood. And part of it was they felt like they were okay if there were only 16 homeless individuals there, but if it's going to be 50, how would we?
Do you want to show that story, Troy? The battle to locate the in-between in a wealthy neighborhood? Because that obviously was a pretty difficult battle you went through.
It was, and there were actually some several times that we had to call the police. We had individuals coming into the facility under the guise of being visitors of our residents, just so that they could kind of try and get the sneak peek of what was going on in the facility. It took well over a year for those few individuals to quiet down, and I think there just wasn't really none of their fears came true. Mm-hmm. They thought that there would be people running around in the neighborhood with needles in their arms, or passing out in their driveway, or following their kids home. There was obviously a lot of talk about the fact that we do allow sex offenders, but a sex offender can move into pretty much any home. And I believe that they're more heavily monitored when they're in our facility. We make sure that they're following their parole or probation instructions. Even if they move from one room to the next, they have to call and say, I'm now in room number whatever. Mm-hmm. So, we make sure that everybody's following whatever legal issues that they need to follow. But we haven't had any issues in the 5 years we've been up at this new facility.
And is it Hillcrest, the neighborhood, or
it's East Liberty Park?
Oh, East Liberty Park.
Yep.
Yeah, it's a nice neighborhood, and there's a lot of wealthy, big homes around there.
Yeah.
And I think that is the toughest battle, because NIMBYism is actually kind of justified when you examine what's happened with the new homeless resource centers.
Right.
And but do you take like kind of hardened criminals and like drug users or psychologically disturbed people?
So we are screening everyone, and we are making sure that we can properly support them. Someone with uncontrolled mental illness would probably suffer without proper support, so we're not going to take that individual. Somebody who is actively using it and not willing to go to detox before they come in, we can't take that individual because we're not a detox. We also believe in wiping the slate clean. So if someone is coming into our facility end of life and they're going to pass away shortly, we really don't care what their past was like. We just believe they shouldn't die on the street.
Yeah, that's great. And so I noticed there's a lot of other big gaps. And the biggest gap I see is just really mentally ill people wandering the streets. And I mentioned before the show, there's a couple of business owners I just talked to yesterday, and they both just said the downtown area they're in is deteriorating really badly, and it's just a few, like they have no problem with homeless people, but it's just a few really mentally ill people. Like this one business owner described, this guy saw his reflection in the glass and just punched the glass, and she's having to replace her window every few months because somebody's breaking her window. Right. Like, do you have any ideas on how the city and the state and the county, how whatever entities can go in and just help just figure out how to put these people who are mentally ill into a facility, in a place where they can actually exist and not cause harm to all the neighbors around them?
Yeah, I don't think that it would need to be that much different than the in-between. There would just need to be a lot more funding and a lot more medical professionals that could support that. Mm-hmm. I'm not sure why we don't have more access for people struggling with mental health, but again, we can't support it. A couple of people, struggling with severe mental health issues that are untreated can just suck up all of the resources at the in-between, and then we're not, providing proper care for everyone else. So there is a huge need for it, and I think there are some organizations that are trying to come up with solutions, but it's always nonprofits, and I think that we need maybe the city or the state to come up with a solution with permanent funding so that it's, the in-between has to operate year by year. Most of our funding comes from private foundations and individual grants. So each year we're looking at what does it look like we're going to bring in, how much can we spend, how many people can we hire, and that's just really not ideal for us when I feel we're providing a really, really necessary service for Salt Lake, if not even, a wider area. We have people coming from out of state because there's no other option for them.
Wow. And so you don't turn anybody away no matter where they're from?
No, it doesn't matter where they're from. We had a resident who we're not even sure why he was in Idaho, but he was from Samoa, and he was with us for a while, and we ended up getting him back home after he got better. But it took a long time because they weren't taking anyone onto the island during COVID, so he didn't really have a place to stay. So yeah,
Wow.
It doesn't matter where they're from. They can come stay with us.
That's just great. Yeah, along the lines of the conditions for chronically mentally ill and homeless, we did a story about, it was about a year ago. I just went outside of the Gerald E. King Center, and I just thought I noticed there were just all these people camped out in front of it, and I thought I would just go interview them and see what's going on, and it turns out there's just a serious problem where really severely mentally ill people are being kicked out of the homeless resource center.
But then they stay nearby.
Yeah, but they stay nearby because they can take a shower there, but they're not allowed to stay there
Right.
because they are such a drain on resources. And this one woman I spoke to, I've got a picture of her. She looked really rough. Her name was Katrina. She was out in front. She just kept talking about how everybody in there hated her, was against her. She had all these conspiracy theories, and I bring this up to you because I think it is the biggest problem because she claims there's 0 caseworkers willing to work with her. And then recently I talked to Sim Gill, district attorney. I had contacted his office a few times, and I finally just saw him at a restaurant, and he said there's no way that these people, even if they're victimizing other homeless people, can stand trial because they're mentally incompetent to stand trial. And it's just like this massive gap exists there.
Yeah.
They're really. Do you think that we need to go back to what we had possibly in the 80s and open up mental institutions, just some place to put these people?
I think there has to be something, because if the shelter is the last stop, but they can't support these people, it's to be expected that they are going to be congregating. And then I think it prevents people who are trying to do anything like the In-Between is doing from opening a facility, because that's what they see. They're seeing these individuals that are the exception, not the rule.
Exactly.
And there's,
yeah.
Hundreds of people going in
They
and out
think
of
everybody's like that.
Yep.
Then they group them all
Yep.
together.
And
they're
so
not.
that's what a homeless person is in a lot of people's minds, because of course, the average person isn't going into a resource center, or maybe coming to the In-Between and seeing and hearing the stories about, people. The people at the In-Between are so similar to you and I, right? We have individuals who, we've had people that they're a nurse or they're a teacher and they got cancer and they lost their job, lost their house, and then they're on the street with this medical crisis. So, a lot of us are just a health diagnosis away from being homeless.
Mm-hmm.
So there's that whole healthcare problem that's another layer of this. But yeah, again, I don't have the solution, but we need something, because we keep trying to solve this one problem and convince everyone that there should be resource centers in neighborhoods, but no one's going to accept it if this is what we're seeing outside of all the resource centers.
Yeah. So do you think universal health care is one solution we need to adopt?
I think so. I mean, hearing the stories from our residents about how hard it was for them to get good medical care and then to even navigate the healthcare system by themselves. And, if they try and have regular insurance with copays and deductibles, they won't ever be able to afford it. So they're trying to utilize Medicaid, and that can be difficult to stay on as well if you're homeless.
Mm-hmm.
There's several people who recently just got kicked off of Medicaid because they didn't confirm their address. Well,
Mm-hmm.
they didn't have an address, and they didn't know that that was something that they had to do. So before they can get their prescriptions filled, they have to go back to maybe 4th Street, which is a great resource for individuals who don't have any insurance. 4th Street will also help you get on Medicaid, and you can get your prescriptions filled for free there. It's really the fastest way we've found for people that are at the in-between to receive proper medical care. But that's difficult too. And again, it's
you have to not have a job to get on Medicaid and be homeless. If you have a certain amount of income, they're not going to allow you.
Right. Yep. There's a variety of different types of Medicaid too. So it just depends. But yes, it almost prohibits people then from going and getting a good job and getting their own insurance. So
it's exactly why I've flipped actually in covering this from definitely no universal health care. It's too expensive. It would downgrade all medical care for everyone. That was my opinion, I would say, a year ago.
Yeah.
To now understanding it's really the only viable solution, because to tell people you can only get health care if you don't have a job. That's a terrible deterrent from the thing that gives a person dignity and respect and self-worth. If they have a job, they're going to feel good.
Yeah.
They're going to feel a whole lot better than if they don't and they have to not keep a job in order to keep their Medicaid.
Yeah. When we've hired house managers in the past that are residents, they've said, "Can you not pay me because I don't want to lose my benefits?"
Or can you pay me under the table?
Right.
And then it creates this whole shadow economy. And
Yep.
Yeah, it was like I was actually the very first podcast of this show. I debated a guy about universal health care because I was so vehemently opposed to it, because it does create death panels potentially where end of life care becomes so incredibly expensive that sometimes as a government you have to triage who gets the most, who can get that super expensive care, and who you have to say no to. And that's a huge downside to it. But on the other hand, if you're creating an underclass of people who aren't working just because they know they can't work if they need their health care, that's much worse.
Yeah. And I think the lack of health care has so many additional costs to it, right? I mean, how much are taxpayers paying for individuals calling 911 and using, the emergency room as their primary care doctor? That's one of the goals of the in-between, is to reduce all of those costs. Have an individual be able to stay at the in-between and go to their doctor 10, 15 times in a 3-month period, versus go to the emergency room 10 to 15 times and using up all the resources of, police, fire department, all of that.
And when you think about end of life care, you guys are providing that right now for homeless individuals, but do you see that becoming a possible model for average people where they could go? I mean, there is hospice, but that can be really expensive. Yeah. But where that could be part of universal health care, or Possibly, I don't know. Yeah, it's
I
a
really
tough
don't
one.
know.
It's one of those societal problems.
It is tough, and
really
that's part of the reason why. So in Utah, there's different levels of facilities. So we're in assisted living type 2, but there's also skilled nursing facilities and licensed hospices. I don't think we would be able to raise enough funds to be a licensed hospice, because we would have to have a physician on site, and some other high-paid positions. So we've really found that being an assisted living type 2 facility where we can have people on hospice and have outside hospice providers provide the care, it's the most affordable way for us to run.
Yeah, makes sense. So I don't know if you've thought about this story, or if you've want to chime in on it, but since 2016, there's been a 600% increase in homeless spending. Wow. And it's resulting in more homelessness. And it's just a problem that I've been studying and analyzing. Why do you think that's happening here in Utah?
I mean, just basing it on what happens at the in-between is we bring individuals in and they get stabilized. Their medical condition is resolved. They've gotten on mainstream benefits or applied for housing, but there's just not affordable housing. So back out to the street they go, and the cost that for someone on the street is way higher than a cost of someone in subsidized housing. So for the in-between specifically, there just needs to be deeply affordable housing, or we're going to see individuals coming back to the in-between in a year or two. I know that a lot of our residents that apply for housing, they get the same comment of it could be 6 weeks, it could be 6 years, and you never know. And how do you plan for that? And so when we tell someone on the streets they should try and get into housing, it's nearly impossible unless you fit some really strict criteria for some set-aside housing. But the average homeless individual could be waiting for 6 years. And there's a lot of costs associated with someone being on the streets for 6 years on the city and the county and state.
Yeah, I think I heard there are currently 3,000 people waiting for housing.
Wow, I don't doubt that.
I wonder why our state legislature gave $50 million to affordable housing when even the homeless czar said they needed $90 million, and why we're not taking that issue more seriously, because it is a big deal. It's like if you look at what the incentive structure looks like, if you're working a job at Walmart and you're earning, I don't know, maybe they earn $15 an hour now, and you're looking at your apartment go out of, your landlord just increased your rent again, and now you're putting 60% of your paycheck into housing, as opposed to if you go out in the street, you can have no rent.
Yep.
And you can get food, and then you can get on a waiting list to get free housing. Yep. It's like there's a shadow ladder that the government's offering that just goes downward. If you stay homeless long enough, you'll get a free, affordable house. Yeah. But if you work at Walmart, you're what are your prospects? Increasing rent, continual increasing food costs, living costs. The equation is just not working out.
Yeah. Again, I'm not sure what the solution is, but I don't think that we're doing the right thing.
Yeah.
Based on how much money seems to be funneling into it, but not much change. If not, it seems like it's getting worse. At least visually, it looks like it's getting worse. The numbers look like they're getting worse. We're obviously seeing an increase, about a 35% increase last year from the year before. So obviously, we're not going to be able to increase much more because we were at capacity for most of last year.
Yeah. And in the meantime, we're talking about $650 million will go toward a gondola for the elites to come here and ski more easily.
That's frustrating.
This is interesting. So we've been looking at homeless deaths, trying to track how homeless people are dying. I found out from somebody that you guys report the people who die in your facility, and how do you guys, and you guys are part of the vigil that's held every year for the homeless that die on the streets and in other facilities. Obviously, some are dying in your facility, but I've been grandma requesting the medical examiner's office, the police department. They've stopped talking to me. They won't give me any figures. How do you help tally this number, and where does this number come from? 159 homeless people in Utah died last year, and why is that number so elusive?
So my understanding is that 4th Street is really the organization that's collecting all those numbers from other organizations or names, right? So if we give a name and someone else heard they died, VOA, say, they might also have it on their list. So my understanding is it's just all of us nonprofits that hear about someone dying, or they died in our facility, or we saw so-and-so on the street. VOA and 4th Street have street outreach, so I think they're seeing it a lot. I don't think that they're getting it from any source, just like you're saying. I don't think that information is getting to anyone. And I don't know why that is, but I'm guessing because it's a bad look, maybe.
And so I want to compare what Salt Lake City's doing with what LA does. LA keeps a very close tally on the homeless deaths. And so on my screen, I think you'll have to, maybe you can pull it up, Troy. Mortality among people experiencing homelessness in Los Angeles County 1 year before and after the start of COVID. So they were tracking homelessness the homeless deaths before COVID and after COVID, which is great statistics to have, especially if you know how they're dying. Right. You can try to alleviate that suffering. and they did this huge report. It was produced by Los Angeles County Board of Supervisors, Los Angeles County Department of Public Health. You know, I'm not blaming the police department. I'm not blaming the mayor's office, but it just seems to me this data on how homeless people are dying, especially the ones that are on the street. We know 15 died over the winter. That this is critical data that our policymakers should be using, and that all the people who are getting homeless funding should be using. Do you think we should do a push for the state legislature to insist that we start collecting this data?
I think that it would be really helpful, even on a small level of the in-between. Like I said, we're having about 15 people pass away at our facility, and it stays steady at that number. But if the homeless numbers are increasing so much, why aren't we seeing more? You know, obviously people who are dying because they freeze to death or maybe an overdose death, those are individuals that would probably never make it to the in-between. But if it's a bunch of individuals dying because of a medical crisis or because they couldn't get hospice services, we want to know that. We want to figure out how to properly outreach to those individuals, and maybe outreach to the police department more and other agencies like that to get individuals to the in-between before they die on the street. So I would love to see that data. I think it would help us come up with solutions.
Yeah. Yeah. Well, I really appreciate your input on this stuff because it's such a massive issue, and there's so many nonprofits involved. There's so many silos. And it seems like, unlike you guys that work directly with the 4th Street Clinic and the other NGOs, it seems like a lot of them really stay in their own silo, and there's just not enough collaboration between all the entities. So I think it's just awesome what you guys are doing, and you know, well done.
Thank you. Yeah, I appreciate all you're doing for the homeless population.
Yeah. Thanks so much for coming on the show.
Yeah, of course. Anytime.
And if you want to be a bigger part of Utah Stories, you can subscribe to our magazine. It is $3 a month at utahstories.com, or subscribe to our free digital newsletter. The digital newsletter is just available also at utahstories.com. And please subscribe to our YouTube channel, like the video. We also have Instagram, Twitter, a lot of social media going on. But we'd love to hear from you. We love comments. We love, you know, all sorts of comments from all sorts of backgrounds on what it is we're doing. I have a comment I just wanted to share real quick on a article in our current issue. It's we did a story on how Caputo's, we write a lot behind this effort. It was, I expect a grocery store to be so much involved in cacao and restoring strains of cacao, but this kudos to Matt Caputo and the folks at Ritual Chocolate for using their abilities to help create sustainable markets in Bolivia and Brazil. Livelihoods. I'm grateful for Utah Stories for publishing such a unique story, Maxwell for her, and I hope to see her on these pages. So yeah, we have a collection of amazing writers at Utah Stories. These were 3 of our contributors and writing 10. You know, what we're trying, and your makes that happen. So see you next time.